Hey, I'm Dr. Ken Berry, author of Lies My Doctor Told Me. Today, I'd like to discuss with you just for a few minutes about a very important topic. And we all know the devastation that type 2 diabetes can bring on someone. So, what if there were tests that you could do at home or at your doctor's office that would detect the very earliest signs of diabetes, type 2 diabetes, up to 10 years before diabetes develops? That's what this video is about, how to detect the earliest signs of type 2 diabetes long before you have the diagnosis so that you can take steps to reverse those problems and to make sure that you never ever develop type 2 diabetes. These are very powerful tools. They're available to every person and every doctor, but for some reason, they're just not used appropriately yet. And so hopefully with this video and with your sharing of this video with friends and family and maybe even your doctor, we can help people understand that type 2 diabetes is not some magical unicorn diagnosis that just pops up out of the blue. It is a metabolic process that is years in the making. It takes years for the average healthy body to become so sick and metabolically deranged that it develops type 2 diabetes. And I'm going to tell you the 5 tests, some of which you can do at home, some that you'll need to do with your doctor, that you can detect the very earliest signs and then take the steps to prevent that from ever becoming type 2 diabetes. So let's talk about these 5 steps. Number 1 is actually a test you can do at home for free. If you have a Taylor's tape or a tape measure, if you will measure your waist at the belly button, gentlemen, not down where your belt rides, but at the belly button, and then also measure your height, divide your waist circumference by your height, and if the ratio is more than 0.5, then you are at huge increased risk of developing type 2 diabetes. For most people, starting to gain weight in the middle, starting to have that belly bulge, that beer belly, that pot belly, that's one of the very first indications that you're starting to store fat in the viscera or in the between your guts inside your belly, or actually much worse of all, to store fat in your liver or even in your pancreas. These are huge red flags that you're moving down the road towards type 2 diabetes, and you need to know this number. And so I would recommend everyone over the age of 30 to check this number once a year, your waist at the belly button divided by your height. And you can do both in inches or both in centimeters. It doesn't matter. Just be consistent with your units of measurement. And if it's 0.5 or lower, you're in good shape. If it's above 0.5, then you've got some work to do. Test number 2 is your triglycerides. Most people and many doctors think that triglycerides are actually a measure of how much fat you're eating, when nothing could be further from the truth. I actually talk about triglycerides in several other videos on this channel, but when you have to eat carbohydrates in order to elevate your triglycerides. And so if you have a fasting lipid panel, and that'll have your total cholesterol, your LDL, your HDL, and your triglycerides on it, if your fasting triglycerides are elevated, that is a huge risk factor for developing type 2 diabetes further down the road. Years, your triglycerides can be a little bit high for years before you're diagnosed with type 2 diabetes. And either many doctors have forgotten this or they never learned it in the first place, but your triglycerides are a huge risk factor for diabetes and also heart attack and stroke. And so if your fasting triglycerides are high, that is the train whistle blowing. And you know what that means? The train is coming and it will run over you. So you need to get off the metabolic tracks by correcting your diet and correcting your lifestyle. Test number 3, C-peptide. This is a blood test that you can either get from your doctor, or if your doctor refuses, I'm going to put a link down in the show notes below for a lab company that you can actually get this done without an order from your doctor if your doctor's being contrary. C-peptide is made at the same time as your pancreas makes insulin. And so it is one of the very first things that will elevate if you're becoming hyperinsulinemic or insulin resistant, which means that you're eating so many carbohydrates that your pancreas is having to work overtime to make extra insulin. This can happen anywhere from 3 to 5 years before you develop type 2 diabetes. And so if you catch the C-peptide even 1/10 of a point above the reference range of normal for whatever reference range lab you're using, that's it. You are insulin resistant or you have hyperinsulinemia. Either way you want to talk about it, huge risk factor for developing metabolic syndrome, but also ultimately type 2 diabetes. Step number 4 is very similar to C-peptide. Test number 4 is a fasting insulin level. Now, if you're already a diabetic and taking insulin, the fasting insulin level won't give you any useful information. But if you are a non-diabetic or a pre-diabetic, or if you're afraid you have metabolic syndrome, then a fasting insulin level will give you a great deal of information and can actually predict that you will develop type 2 diabetes 3 to 5 years before you actually develop it. If your fasting insulin level is even 1/10 of a point above the reference range of whichever lab you use, then you are at risk for type 2 diabetes anywhere from a year to 5 years from the date that test was taken. Test number 5 is a hemoglobin A1C, or just an A1C. What this gives us is a rough 3-month average of what your blood sugar has been running over the last 3 months. It's much more useful information than just checking a fasting blood sugar, because you can be well on your way to developing type 2 diabetes or even pre-diabetes and have a normal fasting blood sugar. Your A1C is going to tell on you, because your A1C checks glycation of red blood cells every minute of every day for up to 3 months. And so if your hemoglobin A1C is even 1/10 of a point above the reference range of normal for whichever lab you use, then you are a pre-diabetic. And let me say, some reference labs give you a falsely high number. So let's give this an actual number. If your A1C is above 5.6, then you are a pre-diabetic and you are moving within the next 1 to 5 years. You will become a type 2 diabetic if you don't take steps to reverse this syndrome before it gets out of hand. Now, I've got multiple other videos on this channel about diabetes, pre-diabetes, high triglycerides, and how to reverse them. But let me tell you, I have 2 playlists that will help you to prevent type 2 diabetes, will help you reverse pre-diabetes, and will help you reverse metabolic syndrome. Metabolic syndrome and pre-diabetes are basically the precursors of type 2 diabetes. For example, the triglyceride test I talked about earlier, even in people who are very slender, and you would look at them and think, well, they're so skinny, there's no way they'll ever be type 2 diabetic. Many people know a skinny type 2 diabetic, and the triglycerides, that's the first test. That's the fasting triglycerides is the first test that's going to be elevated in a slender person that's going to go on to develop type 2 diabetes. And so if you'd like to not wait around until your doctor one day, 5 or 10 or 15 years from now, says, oh, guess what? You're a type 2 diabetic. If you'd like to catch this before it ever develops, before you've ever had that diagnosis written on your chart, then you need to demand these 5 tests from your doctor. And if your doctor refuses, I've got a link to a lab company down below who will do this even without an order from your doctor, because you need to know. You need to never become type 2 diabetic, and these tests can give you anywhere from 5 to 10 years of a heads up that you're moving that way. And so let's say that you've done these tests and one of them comes back positive, that you're at risk for developing type 2 diabetes. I have 2 playlists on this channel, and I'm going to put a link to them down below. One of them is called Keto 101, and the other is called Fasting 101. These are the most powerful dietary interventions and lifestyle interventions that you can possibly do to prevent yourself from becoming a type 2 diabetic. If you're already a type 2 diabetic, you can use them to reverse your type 2 diabetes. If you're already a pre-diabetic, you can use these 2 playlists to reverse your pre-diabetes and prevent yourself from becoming a type 2 diabetic. And you just click on Keto 101 or Fasting 101. There's There's multiple videos in each playlist. Watch them at your leisure and start to change your diet. Diet and lifestyle, that's where it's all at. When you watch television, you would think that the only cure for diabetes is a pill or an injection. This is just not the truth, but it is what Big Pharma would like you to believe. Also, it seems that big medicine would love for you to believe that you can't ever treat, and definitely you can't reverse type 2 diabetes without going to see your doctor regularly and taking lots of pills and injections, and nothing could be further from the truth. All right, now if you enjoyed this video, please take 1 second and click that subscribe button and the little bell notification icon right beside it. That way, every time I have a bright idea like this, you'll get a notification and you'll be one of the very first to know. This is Dr. Berry. I'll see you next time.